start. The University of Notre Dame has become a leader in rare disease research thanks to the effort of the Boler-Parseghian Center for Rare and Neglected Diseases, the Parseghian Medical Research Fund, and many research labs on campus. This enterprise started with just one disease, Niemann-Pick type C, or NPC, a neurodegenerative disease that causes memory loss, cognitive impairment, and motor dysfunction. And one of the most tragic aspects of this disease is it begins in childhood or adolescence rather than later on in life. So joining us to talk more about what's new in NPC research, and there's a lot of exciting things going on, is the director of the Parseghian Medical Research Fund, Sean Kassen. Welcome to Notre Dame Day, Sean.
Thanks for having me.
I love your shirt, by the way. Good. Yeah. Era.
We just got it today.
Ah, that's great. Well, it's great to have you. Tell us a little bit about the Research Fund. Just briefly share the mission, if you would, to start.
Yeah, so it's named after our legendary coach, Parseghian, but it was founded by when his son Mike and daughter-in-law Cindy, 3 of their 4 children were diagnosed with this devastating disease called Niemann-Pick type C.
Tell me more about what makes this specific rare disease so tragic.
Well, number 1, it's fatal. Number 2, it mostly affects children. Now, some children, patients are diagnosed when they're born. Some are diagnosed as adults. But like the Parseghian children, they were born healthy. And you know, when they were about 4 or 5 years of age, they started to notice with their youngest son, Michael, some decline. He just wasn't keeping up with other kids on the playground. And it took a number of years, and that's what another thing that's devastating. It takes a number of years for a diagnosis. And when they got diagnosed, they had to test all their kids because it's genetic, and 3 of their 4 children, unfortunately, were diagnosed with the disease. And it's just very tough because these kids lose their ability to walk, talk. Seizures are common, and they eventually ended up with a feeding tube in a wheelchair and pass away at a young age.
And the Parseghian family has really taken this tragedy and turned it into action, and there have been breakthroughs in this research at Notre Dame. Tell us about the hope here.
Yes. So, I mean, they started this 30 years ago, and nothing was known about this disease. Through great support by so many and a number of great researchers, we've made great advancements there, and we've actually had 4 therapies that have gone through a phase 3 clinical trial. Now, I will tell you, getting therapies approved is very tough. If you came to me 4 years ago, I would have told you we were in a pretty dark place as a community. One of our most recent clinical trials was rejected by the FDA, and patients were losing access. But because of the perseverance of the Niemann-Pick community, the families, and so many, on September 20th of this year, at exactly 10:30 a.m., I got a text that we got the first approval for a therapy for NPC, and then actually 4 days later, we got word of the second approval ever for NPC.
That's a huge, huge deal. How can people support this work, Sean? If they see this tonight, they're inspired. We know there's great work happening here. How can people get involved?
Well, you can donate. I mean, it's Notre Dame Day, and so they can definitely, we can continue to raise funds for this. These treatments are therapies. They slow the progression of the disease, but they are not cures. Our next generation of therapies we're developing, we really believe are going to be those game changers or cures. So please join us and donate. I just want to give a shout out to all the people that have so far, our Niemann-Pick families, our alumni that have supported us, and we have a number of students from the Esteemed Masters program that are working really hard around the clock raising money for us.
Thank you, Sean. Thank you for your tireless work and just being part of the hope that you give these families. Appreciate your time.
We're going to beat this disease.
Absolutely. Appreciate it.